Welcome to the video on lymphedema and self-care. Living with lymphedema means navigating a unique journey, and at its heart lies the power of self-care. It's far more than just managing physical symptoms. It's about actively fostering your overall well-being, encompassing both physical and emotional self-support. Think of self-care as building a robust foundation that empowers you to support your lymphedema. These foundational pillars aren't merely tasks to tick off a list. They are intentional practices designed to promote lymphatic flow, maintain skin health, prevent complications, and crucially, uplift your spirit. By consistently engaging with these core elements, you're not only just reacting to lymphedema, you're proactively shaping your health and resilience. We're talking about tangible actions like adhering to compression therapy, which provides vital external support. Engaging in regular mindful movement that acts as your body's natural lymphatic pump. Meticulous skin care to protect your vulnerable tissue and gentle lymphatic drainage techniques that guide your fluid pathways. But beyond these physical aspects, true self-care also involves tuning into your emotional landscape, acknowledging feelings, celebrating small victories, and fostering a sense of control and confidence. The best part? These pillars can be fitted into your day-to-day living. Small, consistent actions can make a huge difference. Each step you take in your self-care routine is an investment in your comfort, your health, and your happiness. So let's explore how to make self-care an empowering part of your day-to-day life and not a chore. Why are the foundations important? We'll be focusing on the 4 cornerstones of lymphedema self-care: compression, movement, skincare, and massage. But remember, underpinning all of this is emotional support for yourself too. Lymphedema is a chronic condition, meaning it's a long-term condition, and it involves a buildup of fluid due to a compromised lymphatic system. The goal of self-care is to manage this fluid, prevent complications, and maintain the health of your affected limb or body part. Think of these as pillars as your daily allies, working together seamlessly. Gaining knowledge about lymphedema and your self-care also helps you communicate the condition to others, to help them understand. Each of these pillars work together to support your lymphatic system. They're not separate tasks, but rather interconnected strategies that build on each other to give you the best possible results. This is about empowering you to feel better, stay in control, and gain a positive outlook, which I know is really hard sometimes, especially when you're dealing with lymphedema. Compression, your daily support. First up, and often the main cornerstone of lymphedema management, is compression. This isn't just about reducing swelling, it's about providing continuous external pressure to support your lymphatic system, prevent fluid reaccumulation, and maintain limb size. Your healthcare team or therapist will prescribe the right garment for you, whether it's a sleeve, stocking, glove, or a wrap. Getting your compression right is important. Once you've found the right one, it's so much easier to get on with. So if it isn't right first time, don't be disheartened. Try again. The key principles for compression. Wear it as prescribed. This usually means wearing it daily from morning until evening. Consistency is absolutely key for effectiveness. Think of it as putting on your most supportive clothing of the day. Application. Ensure your garment is smooth with no wrinkles or folds, as these can create a tourniquet effect on your body and actually hinder flow for the lymphatic system. If you struggle with application, don't hesitate to speak to your healthcare team about donning aids or exploring different garment types that might just be a little bit easier for you. Care of your garment. Wash it regularly according to instructions to maintain its elasticity. Compression garments have a lifespan, typically 6 to 9 months, after which they lose their effectiveness. Discuss replacements with your healthcare team to ensure you're always getting the best support. The NICE guidelines suggest 2 garments be prescribed every 6 months, 1 to wear and 1 to wash. Listen to your body. Your garment should feel supportive and comfortable, not painful, overly tight or constricting. If you notice any discomfort, skin irritation, pins and needles or numbness, contact your healthcare team. They are there to help you find the perfect fit and solution. Beyond the advice from your GP or lymphedema nurse, there are a wealth of resources available to help you. In the UK, many manufacturers of compression garments and other lymphedema products also offer direct advice and support. You can often find their contact details on their websites. This can be a fantastic way to learn about the different types of products available and ensure you're making informed choices. Think of your compression garment as a constant, gentle and supportive hug for your limb or body part. It's working hard for you all day, every day, helping to manage your lymphedema. It's one of the most effective tools that you have, and making it part of your morning routine can make it feel much less like a chore. Next, let's talk about movement, your body's natural lymphatic pump and a fantastic mood booster. Unlike your blood circulation, which has the heart to pump it, your lymphatic system relies on muscle contraction and joint movement to push the fluid along. So being active is absolutely vital for managing lymphedema. So why is movement so powerful? Well, it boosts lymphatic flow. So every time your muscle contracts, it gently squeezes lymphatic vessels, helping the fluid move. It's like an internal massage. Empowerment. Being active is a proactive way for you to take control, build confidence in your body, and connect with your strength. Improving range of movement. It keeps your joints moving, preventing stiffness, which can sometimes occur with lymphedema. This helps you maintain flexibility and ease of daily activities. And again, we're coming back to emotional well-being. Moving your body in ways that make you feel good is fantastic for stress relief, easing anxiety, and boosting your mood. Choose activities you generally enjoy, and that's the key to your consistency. So the key principles for movement: start low and go slow. So especially if you're new to exercise or have increased swelling, begin with gentle, low impact activities, and then gradually increase duration and intensity as your body adapts. Listen to your body. This is crucial. If something causes discomfort, pain, or increased swelling, ease off and modify the activity. Your body gives you important signals. Please listen to them. Consistency over intensity. So daily gentle movement is often far more beneficial than sporadic intense bursts. Think short, frequent sessions, even 5 to 10 minutes a few times a day. It really adds up. Wear your compression. Always wear your prescribed compression garment during activity, as this also supports your lymphatic flow. So some examples of activity: gentle walking, swimming, cycling, stretching, yoga, tai chi, even little arm circles, ankle pumps and wrist pumps. They really work. Even deep breathing exercise helps move your lymph in the core. So it doesn't have to be complicated and it doesn't need to be hard. It's just about movement. For more insights, see my Being Active with Lymphedema video in the YouTube Lymphedema playlist on My Simple Steps. Your skin is the first line of defense against infection, and for somebody with lymphedema, meticulous skincare is a non-negotiable. Swollen skin is far more vulnerable to breaks, dryness, and infections like cellulitis, which can cause significant discomfort and further swelling and requires medical attention. Essential skincare steps: cleanliness. Wash the affected area daily with a mild pH neutral soap and lukewarm water. Pat dry thoroughly, especially in skin folds or between the toes, to prevent any fungal infections. Moisturize, moisturize, moisturize. Use a rich, non-perfume, pH neutral moisturizer daily to keep your skin hydrated and supple. This helps prevent dryness, cracking, and itching. Apply in the direction of lymphatic flow and allow it to absorb fully before putting on your compression garment. Inspect your skin. Get into the habit of inspecting your skin every day, looking closely for cuts, scrapes, insect bites, rashes, redness, warmth, or any new changes. Early detection of infection is key for you with lymphedema. Protect it from injury. So wear gloves when you're gardening or doing household chores. Be cautious with sharp objects like razors, scissors, or knives. And then use insect repellents when you're outdoors. Sun protection. Sunburn can really aggravate lymphedema and damage your skin, so use high SPF sunscreen consistently. Foot care. If your lymphedema is in your leg, regular foot checks are vital. Ensure proper nail care and comfortable, well-fitting shoes to prevent blisters and pressure points. If you notice any redness, warmth, increased pain, or a red streaking in affected area, and you develop a fever with flu-like symptoms, please contact your doctor or 111 immediately. These could be signs of cellulitis, and that needs prompt medical attention. For more information on cellulitis, go to the Lymphoedema Support Network website or the British Lymphology Society. Let's talk about lymphatic drainage techniques, often referred to as self-lymphatic drainage or SLD. This is a very gentle, specialized massage that helps move fluid from congested areas to healthier lymphatic vessels. Your therapist might have taught you some basic SLD techniques tailored to your specific needs. However, if you haven't been taught this, then there are some key points for self-lymphatic drainage if you're starting from scratch. It's a gentle touch. This is not a deep tissue massage. The lymphatic vessels are just under the skin, so the touch should be very light, just enough to gently stretch the skin without causing redness or indentation. Clear the core first. Now, what we mean by that is we need to actually clear the way for the fluid to come into the center towards the heart. So we're going to start by clearing areas closer to the body's healthy lymphatic junctions, usually the collarbone, neck, armpit, and groin, before working on the swollen limb. Your therapist will show you a specific sequence. However, if you haven't been shown the sequence, there is a quick boost routine on my YouTube channel in the lymphedema playlist on My Simple Steps. Slow rhythmic strokes. It's very similar to your heartbeat. The movements are slow, rhythmic, and repetitive, designed to encourage fluid movement in the right direction. It's all about coaxing the fluid along. So always start from the nearest point to the body and work there before working further along the limb. What this does, it clears the way for the fluid to move to the center. Consistency. Short, frequent sessions are often far more beneficial than longer, infrequent ones. So you can do this while you're watching TV or relaxing. Hydration. Ensure you're well hydrated before and after performing self-lymphatic drainage, as this supports your overall lymphatic function. If you haven't been taught SLD, or if you're unsure about the techniques, please speak to your specialized lymphedema therapist or healthcare team. You can also find a variety of helpful videos online to guide you, such as those on the Lymphoedema Support Network's YouTube channel. But remember, even very gentle, mindful stroking in the right direction can be beneficial. So there you have it, the 4 pillars of self-care: compression, movement, skincare, and massage. But as we discussed at the start, true self-care is about nurturing your whole self, and that brings us to emotional support. Living with a chronic condition like lymphedema can bring a range of emotions: frustration, sadness, anxiety, and even isolation. Acknowledging these feelings is the first step towards managing them. So some tips for emotional well-being. Connect with others. Reach out to support groups, online or in person, friends, family, whoever you feel that you connect with. Sharing your experiences can be incredibly validating and reduce feelings of isolation. Practice mindfulness. Techniques like deep breathing, meditation, or simply taking a moment to focus on your senses can help manage stress and anxiety. There are many free apps and online resources available for you to use. Celebrate those small victories. Acknowledge every effort you make towards your self-care. Did you wear your compression all day? Great. Did you do a walk? Fantastic. Every step matters. Celebrate that. Engage in joyful activities. Make time for hobbies and activities that uplift your spirit and bring you happiness. This could be reading, listening to music, dancing, gardening, or anything that brings you joy. But seek professional help if you need it. It's okay not to be okay. If you're struggling with persistent low mood, anxiety, or feelings of hopelessness, please reach out to your doctor or a mental health professional. Remember, this isn't about being perfect every single day, but it's about you building a consistent, sustainable habit that empowers you both physically and emotionally. My tips for success are all about integrating these strategies into your life in a way that feels natural and supportive. So integrate, don't overwhelm yourself. Find ways to weave these practices into your existing daily routine. Maybe you moisturize after a shower, have a cuppa, and then put your compression garment on. Perhaps you do your self-lymphatic drainage while watching TV. Perhaps you park the car a little further away from your destination. Small, consistent efforts make a huge difference over time. Nourish and hydrate your body. Beyond the physical techniques, remember the power of nutrition and hydration. Eating a balanced, healthy diet and drinking plenty of water supports your overall health and can help your lymphatic system function far more efficiently. Less waste in means less waste for the lymphatic system to deal with. Manage your weight mindfully. Maintaining a healthy weight can significantly impact your lymphedema. Even small sustainable changes can reduce the load on your lymphatic system and improve your comfort. Talk to your healthcare team for personalized guidance. Recognize and respond to inflammation. Become attuned to your body's signals, especially signs of inflammation. This could be increased redness, warmth, pain, or swelling in an area. Early recognition and prompt action, often in consultation with your healthcare provider, can prevent complications like cellulitis. Be patient and really kind to yourself. Lymphedema management is a journey, it's not a sprint. There will be good days and challenging days. Celebrate your efforts and progress, no matter how big or small, and treat yourself with compassion. Stay connected with your healthcare team. Your lymphedema therapist, your doctor or nurse are your best resources. Don't hesitate to reach out with questions or concerns. They can provide you with personalized advice and support you as your needs evolve. But also remember, you are the key to your own success. And trust your instincts. Ultimately, you know your body best. Pay close attention to how it feels. If something doesn't feel right, or if an activity seems to aggravate your symptoms, adjust your routine as you need to. Your body gives you invaluable feedback. Learn to listen to it. By taking these steps, you're not just managing your lymphedema, you're actively investing in your health, your well-being, and your quality of life. You are really important in your self-care. Remember, this isn't about being perfect every single day, but building consistent, sustainable habits that empower you both physically and emotionally. You are the key to managing your lymphedema. My final thoughts are about empowering your choice and making this self-care routine truly yours. Your life is unique, and so is your lymphedema. Don't feel pressured to do everything exactly the same way every day. Perhaps one day a long walk fits in. Another day it can be gentle ankle pumps while you're having a morning coffee. Maybe you prefer self-drainage in the evening to wind down, or a quick session before you get dressed. The goal is to try different things and find what genuinely works for you, your lifestyle, your energy levels, and your preferences. Experiment, adapt, try different things. With a wealth of information online, it's really easy to feel overwhelmed. My advice is to choose the resources and tools that truly resonate with you and your needs. And remember, you don't need to spend a fortune on looking after yourself. If you are considering a significant purchase, for example, a pump or deep oscillation machine from a reputable company, don't hesitate to ask if they offer trials or loan options so you can be sure it's the right fit for you before you start committing. Discover what feels good and what you can realistically sustain. This is your journey, and you have the power to shape it. Thank you for taking this time to empower yourself with self-care, looking after yourself and your lymphedema.